Hello, hello, hello. It's Dr. O here. I'm in Nova Scotia for a conference. So shout out to the Public Health Conference, TPHA. So it is actually 8 p.m. or almost 8 p.m. Atlantic time for me and 7 p.m. Eastern for you folks. But welcome, seeing Layla, Leah, Presh. Welcome into the room. There is my guest who just joined, so I'm going to invite her to join me. Okay, we've got Dr. Let's see if that worked. It should have worked. I'll have her on in a second. There we go. Hey,
Hello,
girl.
how are you?
I'm well. How are you?
Doing really well too. I'm excited to be here.
Yes, welcome. People are just tuning in. I was
Okay.
letting people know that I am in Halifax
Yay!
today, so it's 8 p.m. Atlantic time for us,
Exactly.
7 p.m. ET, my previous time zone. I'm here for the Public Health Conference and the BHEC
Yeah,
Retreat, Black Health Education Collaborative. But I'm gonna do the formal stuff. Let's do the formal
for
stuff,
sure.
and I'll properly introduce you,
Absolutely.
and then we'll jump into it.
Sounds good.
But yes, welcome. People are joining. People are coming on in. So,
Yeah.
welcome all to Healthcaring Differently. I am Dr. O, and every Tuesday at 7 p.m. Eastern Time or 8 p.m. Atlantic, I interview healthcare leaders who are different and doing things differently. So yeah, I'm coming to you live and direct from Halifax today and in the hotel. But one thing that remains the same is our newsletter. The April newsletter just went out. So please sign up on healthcaringdifferently.com so you can get information on diversity pathway programs, application programs, scholarships, research opportunities, and different, we're going to be posting a lot on different job opportunities in the hospital. I want to introduce my guest for today. So, Dr. Leah Jones. I've been calling you Leah in my mind, by the way.
Oh, that's okay.
It's weird to call her Leah. I was like, oh, watch.
It's
Glad I cleared that
okay.
up.
That's
Dr.
fine.
Leah Jones. I'm just letting you know. Full
Thank you.
disclosure. Mispronouncing your name the whole time. Sorry.
That's good.
Dr. Leah Jones is an African Nova Scotian family doctor and the academic director of Black Health in the Dalhousie Faculty of Medicine. She was born and raised in Dartmouth, here in Nova Scotia, and graduated from Dalhousie's Medical School in 2018. So she's a fairly recent
Hmm.
graduate,
Yeah.
and then became a family doctor.
Hmm.
Her role in Dalhousie's Faculty of Medicine is working to engage the African Nova Scotian and Black community with the university and increase representation of Black medical students, and advise on curriculum and creating a more inclusive learning environment. She also works at the Nova Scotia Sisterhood. We're going to talk about the
Yes.
sisterhood in a little bit.
Yes.
Yes, she works at the Sisterhood, which is a province-wide free program for Black women to access healthcare in the historic Black communities here in Nova Scotia. And she also provides healthcare to people who use drugs at the Direction 180 and the Halifax Infirmary. So at a different site. So working in addictions and working in Black health. I also, because I'm at the Center for Addictions and Mental Health and work in Black health. So I
Yes.
appreciate you.
I
I appreciate you, girl.
appreciate
Oh,
you.
Sophie's giving you a hand of
Oh,
applause. So
oh, so
yes,
sweet.
yes. Oh,
Well,
welcome.
I'm feeling so honored to be here.
Mm.
It's such a great initiative that you're doing. It's really inspiring to hear other people's stories. So happy to share mine.
Yes, no, I'm happy that we're able to make it happen. And
Mm,
so usually I like print out my notes, but it's like
all
I'm in the hotel now. I'm like a little like I'm a
good.
hot mess. So I'm
Don't
just
worry.
looking a little bit to the side.
That's okay. Don't worry.
But yeah, I mean, really, I think it's
Mhm.
important to maybe talk about like how and why, because I think
Mm,
in your description or your bio, it's clear that you're health caring differently, right? Like
right,
you're
right.
working in the sisterhood, working in addictions, you're the Black Health director, but
Yeah.
a little bit of like how and why. I think the why is
Why?
a major piece of you health caring
Hmm.
differently. Hmm.
Absolutely. Yeah. Yeah. It's a good point because it's clear through what you said, but then reflecting on really why do you do the work that you do? And I always knew I wanted to be in the helping profession, and I saw that because I watched my parents, who they were a biracial couple. They had so much love and so much kindness to give to this world, and even in the face of discrimination or
Hmm.
racism that we would go through as a family in Dartmouth, they
Hmm.
always treated people with kindness and respect and gave them the benefit of the doubt, even
Hmm.
when maybe I didn't understand, like, why aren't you getting mad, or like, why aren't you doing more in this moment? And so I was
Right.
reflecting on that, you know recently, honestly, and why I chose this advocacy road, or why I choose to work with the people that I do. And,
Hmm.
obviously, it has a lot to do with the way that I was raised and the way that they taught me to be empathetic, and really modeled that for me.
Hmm.
And,
Hmm.
thinking back where I grew up in Dartmouth. Dartmouth is like the Hamilton of Toronto. It gets a
Right,
bad
right.
rap
Okay,
sometimes.
okay. But somebody sent hearts. I saw hearts go up
Yes,
when
I
you said
love
Dartmouth.
Dartmouth.
So
I love
there
Dartmouth.
was love there.
Oh yeah, I grew up in such a loving environment with my family and my friends. My aunties were always there, being very purposeful about making sure that I saw people that looked like me in my books and
Mm.
my toys and all of that. Like, I
Yeah.
I love my family so much, and my friends, and where I grew up, because it made me who I am. But in Dartmouth, there was quite a lot of injustice, like, related to
Mm.
the social determinants of health. And I mean, we grew up
Mm-hmm.
in a place, I guess we would say, like, the working poor, like, I
Mm-hmm.
grew up in a
Mm-hmm.
duplex. Like, I never felt like I wanted for anything. But,
Mm-hmm.
as I got older, I recognized differences between me and my friends at school. And, you
Yeah.
know, the the trauma and violence that my colleagues had, well, my friends,
Yeah.
growing up
Yeah.
at a young age, seeing that and knowing that I wanted to do something to change that.
Mm.
Yeah,
Mm-hmm.
yeah, whatever it might be. And when I was younger, I wasn't like, oh, I'm going to be a doctor. I just knew I
Right. Yeah,
wanted
me
to
too.
help people. Yeah,
Yeah.
yeah, exactly.
Yeah.
Yeah.
I think that that's huge, right? Like, because some people, like for instance, when I interviewed Dr. Marsha Anderson a couple of weeks ago, she really
Yeah.
talked about experiencing
Mhm.
racism in the healthcare system and then wanting to resist. So she wanted to go to
Ooh,
be a doctor to resist. I think for you, it's kind of like the opposite, being immersed in community and
mhm.
experiencing community and being like, I want to support, right? I'm
Absolutely.
probably a mix of both. I had both,
Right.
growing up and then deciding to do that in medicine. But I grew up in Montreal and then I moved to
Okay.
Toronto. For I think the Black experience is different in
Hmm.
Nova Scotia, and maybe you want to
Right.
speak a little bit to that.
Yeah, yeah,
Yeah.
definitely. You know, most people know, and some people don't, but there's a rich history of African Nova Scotians in this province that dates back 400 years. There's, more
Hmm.
than 52 land-based African Nova Scotian communities,
Hmm.
and they're very diverse, but have also been here for a very long time and experienced colonialism, and
Yes.
also, you know, anti-Black racism. And
Hmm.
that history is, like, it's in the soil here. It's not that far in the past.
Yeah.
Like, the legacy of the anti-Black racism is
Hmm.
is very specific and targeted communities here. For example, most people know about Africville, and moving people out of Africville in dump trucks and
Yeah.
giving them, you know the land that was not the most desirable. And, for example, another example would be my dad's parents, who I unfortunately didn't get to meet. They
Mm.
passed away before I was born, but
Mm.
from Barbados, they immigrated to Whitney Pier, and
Oh,
that's where they,
wow.
yeah, yeah. So they worked in Whitney Pier, which is a historic Black community, at the steel mine.
Hmm.
And for those of you who don't know Whitney Pier, it's in a beautiful community in Cape Breton. I didn't grow up there, but that's where
Hmm.
my roots are.
Right.
But there's terrible environmental racism there with the tar
Hmm.
ponds, the Sydney tar ponds, they're right there, and the steel plant. And we were in Whitney Pier with my father over Easter, and there was actually like a news article about cancer rates in Cape Breton, and
Hmm.
we were around the table talking about everybody's family, and it's obvious the environmental racism that has caused cancer to people in Whitney Pier, and
Damn.
and that would be African Nova Scotians. So
Yeah.
yeah,
No,
yeah, it's
that's
very important to know that history. Yeah,
yeah, no, absolutely. And I was really, for me, I mean, on my end, I do know the history, but it's
yeah,
different
yeah,
when you describe it, like what's happening now or how close
yeah.
people are to generationally the atrocities. Because I spoke
Right.
to a leader, maybe I won't say her name just in case she doesn't want
Fair.
me to describe it publicly. But she was talking about her own grandmother, and she's maybe a little bit older
Mm.
than me. Like I'm not talking about somebody who would be of a retirement age, let's say.
Hmm.
And she was saying how her grandmother had been sold at 9 years old, towards the end of slavery to pay off a debt, right?
Wow.
By a white family, and
Hmm.
so and then like you mentioned, Africville, or the cancer that's happening now
Yeah.
based on the environmental racism. Like I feel like people don't always realize how. First of all, some people don't even know what happened
Right.
out here in Nova Scotia, but also don't realize that it is ever present in
Exactly.
community, and it
Hmm.
makes me wonder. So then
Hmm.
African Nova Scotians, black Canadians in general,
Hmm.
but African Nova Scotians are also extremely underrepresented in medicine. And our
Absolutely.
audience here is all about that, like getting into medical school or getting into healthcare,
Hmm.
or at least exploring it or curious.
Yeah.
But I'm wondering if you experienced challenges or anything like that
Hmm.
in preparing for medical school, or once you started.
Right. Right. Yeah. I mean, it's obviously a hard, challenging process, but it is for everyone, but it can be harder for
Yeah.
others, especially if you don't see yourself represented.
Hmm.
And especially if I grew up a shy, timid kid. I didn't have a lot of confidence, and I knew, like I said, I wanted to help people. I wanted to be in a helping profession, but I never pictured myself honestly as a physician early on. But then
Hmm.
I met the people that really instilled that confidence in me. Um, obviously my family, like I said, had been doing
Yeah.
that all along, but then to have Black academics who really, you know, I'll name drop like Dr. Barb Hamilton Hinch. I
Yeah, shout out to
yeah,
Barb.
shout out to
She don't
Barb.
she
And
don't go on
she's
Instagram, but shout
no,
out to
she's
her
not
anyway.
here. And she's still lifting as she climbs with
Yes.
students, and I aspire to be like her because she really was single-handedly one of the people that got me to interview for medical school, I would say. And I owe her
Oh.
so much for that. Um, yeah, it's a beautiful journey with her and people
Hmm.
like Dr. David Hawes and um,
Yes.
the plans community, so promoting leadership for African Nova Scotians, the Health Association of African Canadians, so the
Hmm.
community-based organizations, which would be Sharon and Dr. Hawes at the time when I was
Yeah.
trying to get in. It's like all of these people who see so much in you when you're younger, or maybe not don't
Yes.
have the confidence or the, you know, insight at the time to know that you can do it too and that you need to do it. Like
Yes.
you want to and you
Yes.
need to do it and we
Yes.
need
Yes.
you.
No,
Yeah.
I had
Yeah.
I had that kind of mentorship. I had tough love. They're like, go into medicine. You are stupid. You have the grades. And I was like, now.
Yeah, like
Um,
obviously you
but
could do it. Yeah.
and I was like, No, I don't want to.
Yeah.
It took a lot more than that, but it was actually
Yeah.
seeing young people my age, like Dr. Robin Simpson. She's a hematologist,
Oh,
but she was a first year medical student at the time. But that's what it
amazing.
took because they're yelling at me, did it work? But for those of
Yeah,
us who don't necessarily see ourselves in medicine, we need. I mean, that's why we have this show, this Instagram
exactly.
piece, so that you can see those inspirational pieces. And maybe if you don't
Hmm.
watch and say, yeah, I'm going to become a doctor, it's okay. But we want you to have those exposures because we didn't
Absolutely.
necessarily always have those. I'm
Hmm.
going to ask you another question in a second, but there is a question
Yeah.
that came in from Talkative or
Yeah.
Talkative. I love that name because,
Beautiful.
yes, I'm talkative too. And so the question is, will a recording of this season
Hmm.
be available later? Yes, in many forms. So already on the Instagram page for at Healthcaring Differently, you can see the previous episodes. So it's all on the Instagram page. On our website, healthcaringdifferently.com, or even if you put in healthcaringdifferently.ca, it'll bring you to the same spot. And we've got all of the previous episodes. And then we usually also give you links to it in the newsletter, so you can sign up for the newsletter where we do promote plans and
Yes.
the programs here. So yes, catching some love. Thank you. But I love that when I ask, did you think you were going to be able to do that? You're basically describing the village,
Yes,
right? Like the
exactly.
village came and said, yes, you can do
Yeah,
this, right? Oh, that's so
absolutely.
beautiful.
And it's so lucky. Like, I'm so grateful for that. And like the village was with me for non-medical, the idea of advocacy and fighting for what's right and being against racism that came through my family.
Mm,
But then, the idea of, yes, you belong here, that really came from those folks in community in Dal. So,
that's
yes,
beautiful.
yeah.
Yeah, and I think I love even what you said about Dr. Barbara Hamilton Hinch. So I did a public health elective out here as a resident for 3 months
Oh,
at Capitol Health with Gaynor Watson
oh,
Creed, but I met Sharon Davis
amazing.
Murdoch, I met
Yeah.
Barb, but so I know them from back in the day, early in my own training. But what I loved is that, like, she lifts as she climbs,
Hmm.
right? And that is so important. And I think for those of us who didn't have like parents who were doctors or didn't
Yeah.
have that privilege, we know that there were people who were lifting as they were climbing, and we feel motivated. I don't know, obligated
Yes.
sometimes, but
Yeah.
motivated, motivated to do the
Motivated though.
same. And
Hmm.
I want to ask you, so you finished your medical school, and I know you spent some time
Yes.
in Ottawa, but then you decided to come back
Hmm.
and then leading this kind of work. Let's talk about this work that you're
Yeah.
doing. And I want to hear questions from the audience. I'm just going to
Yeah.
ask Leah this one question, then I want to hear from you folks. But tell us a little bit about sistering and the Black
Yeah.
Health Director role, because you're
Definitely.
definitely doing the same lifting as you climb. So tell us about that.
Yeah, I'm so grateful for that. In medical school, like I graduated in 2018, I worked with one of my good friends, Dr. Akila Wiley.
Mm.
She's Dr. Akila Wiley now. But we were both in medical school and we worked closely with Hawk and we were really fighting for things related to Black health at the time. And that gave me a lot of like strength and energy during med school, but then went to residency at McMaster and she went to U of T. And then, it wasn't our community. So that kind of thing wasn't top of mind. And we also were just trying to get through
Yes.
residency at the time,
Yes.
which we graduated right in the middle of the pandemic. But then,
Pandemic.
yeah, so then I started practicing and was finding my own adventure. Did some rural emerge, also some primary care, but also always doing care for people who use drugs.
Mm-hmm.
But then I felt like something was missing. I, knew I wanted to move back to Nova Scotia, where my partner and I have family, and
Mm-hmm.
family's getting older, not the best health, and then this job came up and I was like, oh no, I won't be able to apply for that, and that's that constant
Mm-hmm.
imposter syndrome.
Yes.
And just,
Yes.
wow, and just know that, you know, that comes in waves, sometimes worse than others, but we all get it.
Yeah, and then you have
um,
to tell to shut the hell up. It's always kind of there, but
exactly.
imposter
It's kind
syndrome,
of always
listen.
there.
Yes,
Go
but as long as
away.
your purpose is louder, that's what I've been
Yeah.
telling these young folks. It's like as long as your purpose is louder, the gifts that you're bringing, That should always be louder
Yes.
than the imposter
I
voice because you're bringing
love
something.
that.
And
Yeah.
you are. Yeah. So sorry, I interrupted. Go
Yeah.
on, go on, go on,
Oh,
go on.
no, no, I love that though. It's a great way to frame it because it is always there. But yes, remember what you're bringing because it's so needed and so important. But yes, so I applied to this job and then I was lucky enough to get it. And then we made the decision, are we going to go home? Are we going to like go home so early? And I said, yeah, like I think this is what is missing out of my clinical care, like this purpose and this feeling of giving back to the community that has given so much to me as
Yeah.
well. Like I feel a lot of strength from doing that as well. And um, I also find it's such a big privilege to do the work that I'm doing. So for the clinical work, I'm working with Black women through the Nova Scotia Sisterhood, and I'm on a team of Black
Okay.
women. Yes, and it's
Mm-hmm.
amazing. And I should say the reason that it exists is because of community organizations talk,
Mm-hmm.
and because of the Nova Scotia Brotherhood that had been in existence for 8 years, led by Dr. Ron
Oh,
Milne.
I didn't know
Yeah,
that they had come first. That's so interesting because when we think
yeah,
about kind of gender-based health services, usually it's women's health that goes before men's health just because of the advocacy or whatever. So I think it's really interesting
yeah,
and cool that the brotherhood happened first and then
came first.
yeah. Good.
Right.
Cool.
And it was based on a Chicago model of
Mm.
care.
Okay.
Um, but lots of advocacy, community advocacy with the health authority to get that even through the door. And so then now they were able, as Dr. Ron Milne was treating women anyways, but it was nice for me to come in and help him out because he was carrying a lot and still carries a lot. And um, so now we go to different clinics once a week and provide kind of more episodic primary care at this time. A lot of people have no family doctor, and the program
Mm.
initially was built to be kind of episodic in nature.
Okay.
Um, but we're noticing that what our community needs is longitudinal,
Right.
comprehensive,
Yes.
interdisciplinary primary care.
Yeah.
And so,
Stable, consistent care. Yeah.
exactly,
Okay.
exactly. So we're advocating for that as a group as the sisterhood because we have, a team lead, a social worker,
Okay.
community liaison, admin,
Mhm.
and yes, I think that's all for the sisterhood.
Mhm.
We're
And then we
all
have a
advocating for
question.
more.
There's a question
Yeah,
coming up,
yeah.
but
I'm
no,
rambling.
talk about your role at Black Health. But Melwood CA, we'll get to
Mm,
that question in a
I
second
like that
about
question.
yes, sacrificing. I certainly did. I
Yeah.
had my little weave back then. Anyway,
Yeah,
I,
yeah, yeah.
I sacrificed some authenticity, but we're gonna hear if you
Yeah.
had to. But
I love that.
let's let you finish on the
The Dow.
academic Black Health Director role. Yeah.
Yeah, it's so great. So again, I'm working as the academic director of Black Health. It's 2 days a week, so it's not clinical.
Okay.
And I'm working mostly with medical students and um, doing some curriculum reform as well. But there's already a lot of folks who are experts in Black Health who have been doing that. I'm joining the conversation and learning a lot from them.
Yes.
Um,
Shout out to Dr.
yeah,
Onye Dryden.
exactly.
Yes, Onye.
Who,
Yeah. Go on.
you know, these people are just so amazing. I feel honored every day to learn and work with them, and they've been teaching me so much. Um, but yes, so lots of supporting students, but also like
Mm-hmm.
advocating for change when it comes to anti-Black racism within the curriculum and trying to challenge that head on. And one of the biggest things that we're doing too is with admission. So now there's the Black Learner Admissions Pathway, which is in its
Mm.
first cohort, going to
Yes.
start this August. So a beautiful thing that has come.
Congrats.
Yeah, thank you. It's a congratulations for the community and the people really who have advocated for this again. I
Mm-hmm.
walked into this already being approved, but I'm really grateful to be able to lead it in this way, um,
Mm-hmm.
and have a team of people who are so invested and supportive of the work. So those are
Good.
that's a couple things, but yeah,
Yeah.
it can be it's amazing. It's amazing.
No, no, no. That sounds fantastic. All the things that are bubbling up.
Yeah. Yeah.
But yes, okay. So Melwood, we gonna answer your question now. And everybody
Hmm.
ask your questions now. We've got six
Yeah.
minutes left, so definitely ask your questions. But yeah. So the question that Melwood say or Melwood Ka, I don't know. Apologies if
Hmm.
I mispronounced. But did you feel you had to sacrifice any of your authenticity to progress in med
Mm,
school and in practice?
absolutely.
Yeah.
I really am so glad that you asked this
Yeah.
question. It's it's hard going through medical school at times. Like this isn't a space that's familiar to a lot of Black people, it's not a
Mm-hmm.
space that makes you feel like you belong. And like not having that feeling of belonging can really take away your sense of self. And
Mm-hmm.
you can try the best that you can to conform to, especially during medical school, because you're evaluated and you're trying
Yes.
so hard to get to whatever you're trying to get to.
Mm-hmm.
um, and it can take take you away from the bigger picture, definitely. And I think it did steal me for a while. I was really going for a merge at one point, and I didn't work out. I didn't match to an emerge program, and then I matched to family.
Mm-hmm.
um, and I, at the time, was really heartbroken because I thought I was a failure, and
Mm-hmm.
that was what I was supposed to do, and there
Mm-hmm.
wasn't anything else that I wanted to do, really. And I thought, I'd go into family and do the +1 and get into emerge and all of this, like very, 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 very
Yeah.
focused on a specific
Mm-hmm.
thing. And when it didn't work out, it felt like the worst thing ever. But then I went through family and I was feeling like almost like I was getting myself back, like my true self. And
Yeah.
I was working within community and, you know, caring for people who were equity deserving. And I felt like in those encounters, I can be my most authentic self.
Yeah.
And that really brings so much confidence to me too, because I know that that is rare, especially for people with addiction or people who are marginalized Black people in healthcare systems. So
Mm-hmm.
I really, really appreciate that question, and I reflected on that a lot. Um, it's it's good to check in on yourself a lot, when you're thinking
Yeah.
about who you are at the core, and it's okay to kind of, you know, it's
Yeah.
okay to conform a little bit and like do what you need to do to get through,
Yes.
because it's
Yes.
it's it's unsafe at times,
Yeah.
but it is a lot safer as a staff.
That's right.
So
Yes.
yeah,
Once you
yeah,
get that MD behind your name, and particularly once you're finished your training. But love
yeah.
was sent to you when you were saying
Oh,
family medicine and
good, good.
refugee,
Yes.
so there were hearts. And then
Yeah.
Kajia says, thank you for your representation
Oh,
in Nova
oh,
Scotia. So
of
sending the
course.
love. We're getting the love. Y'all, there's 3 minutes left. Bring your
Yes.
questions.
Any questions?
Yeah, bring the questions or comments. Send the love too. We love the love. But yeah, so Ritu Basin, so she's an EDI specialist that I had on my podcast, the Race, Health, and
Oh,
Happiness. But
yes.
she was like my first guest, and she talked about her book, The Authenticity Principle. And she was just like,
Mm,
between authenticity and being performative, there's all this middle
right.
ground, right? And so
Yeah.
sometimes, like even if you're authentic, the way you are with your mom might not be the way you are with your friends.
Right.
And depending on the working environment you're in, sometimes you do need to perform. But the point is
Hmm.
kind of as you get older and figure things out, first of all, it could be a playful space, like figuring out how much you want to push it. Do you want
It's
to wear
true.
blue hair or not wear
It's
blue hair?
true.
But then you have to, as you know who you are, the performative piece can get exhausting, right? And then it becomes not
Absolutely.
playful at all.
Hmm.
And then you try to
Hmm.
design a life for yourself where you can be as authentic as possible. But sometimes when you're going
Yeah.
through your training, it's not always possible. There's
Hmm.
some things that even happen that you just put in your back pocket as an
Yeah.
injustice. You can't always speak out about stuff, but you stay true
Right.
to who you are. And when you get to that point, then you can, you know
Yeah.
what I mean? Address those things. I think
Absolutely.
sometimes people get lost on the way to, like, when they get there, they're going for the next thing and not
Yeah.
remembering to, as you said, like, lift as they climb.
Yeah.
But ultimately, I would say don't be too stressed out if you can't be your full authentic self in class or something like that. Like,
Hmm.
with time,
Yeah,
Fortunately, it is possible, and
it is.
hopefully even in the classroom it is, but sometimes
Yeah.
it's
Yeah.
not, and so you have to kind of look at where you're going to instead of what you're going through in that moment. Where you're going
Yes.
to get there, then yeah,
Yes. I
yeah.
love
Oh, we
that.
got some
I just
comments.
reflected on
What?
I pierced my nose in med school.
Mm.
It was like in first year.
Nice.
And I remember one of my colleagues was like, one of my white male colleagues had some insight and he was like, Leah, why would you do that? That's just something else that they can use against you. I'll never forget him saying that to me. It was
Mm.
interesting. But it was also like one of my pushbacks against
Yeah, the
the
rebellion.
status
Yeah,
quo.
yeah, yeah,
Yeah, and I
yeah,
never got in trouble for my notes.
yeah, yeah. And that's it. You have to do what you're comfortable with, right?
Yeah.
Like at a certain point, I wore natural hair. You know, I have a
Yes,
tattoo, but it
yes.
was like, you know, not visible. But some people do, you know, once they get to residency, like have a full arm that's tatted. Some people wait
Absolutely.
until they're staff, you know what I
Yeah.
mean? When they get to where they want to be. So it depends on your comfort with
Yeah.
pushing and what the pushback might be, right?
Absolutely.
Melody, I said, thank you so much for your response. Okay,
Yeah.
yes, yes. Oh, it's 8:30. Okay, so
Yeah.
usually we wrap up around now, but I'm curious if folks have any other questions or anything like that. I'm not letting you go though yet, because I want you to talk a little bit about the application
Yes,
programs and plans, like for folks who
yes.
might be interested in that or want to share it with friends or family. But if people have comments or questions, this is the
Absolutely.
time. But yeah, do you want to talk a little bit about these different opportunities?
Yeah. So, I mean, for anyone who's thinking about health professions in general and they identify as Black, you don't have to identify specifically as African Nova Scotian. It's for all Black people, but in the name, it's promoting leadership for African Nova Scotians. It's a program that sits right within Dalhousie Medicine. However, we're tied to also the Department of Health and Dentistry. So Dr. Barb Hamilton Hinch and I are the co-chairs of plans. And what the purpose is, it's actually its 10-year anniversary. And like I said, I'm kind of a baby of
Yay.
plans because
Right?
it really started with Barb and Sharon and Dr. Hawes. But we have lots of programming for people from junior high to high school, first year medical students, terms, in between undergrad, there's lots of opportunity for us to help. So whether that be financial or, mentorship programs, we have a lot of mentorship opportunities because we're just, it started off small, it's getting a lot bigger, but there's a great connection of Black healthcare providers here in Nova Scotia. So reaching out to plans and following our Instagram handle, you'll see all the recent news. And if you ever need to reach out to me specifically, I'd be happy to help. For people who are, you know, in undergrad or thinking about applying to medicine, um, and you're here in Nova Scotia, there's the new Black Learner Admissions Pathway, and it is open to anybody in Canada who wants to apply. The
Nice.
purpose is to increase representation within medicine for Black physicians, and even more specifically, increasing African Nova Scotians and Black Maritimers. So earlier on, we
Amazing.
talked about, the injustices that
Oh,
are
you're getting
within the
hearts,
soils.
hearts when
Oh,
you said
good,
African Nova
yay!
Scotians. It's like the key
Oh,
word. Every time you say
yay!
African Nova Scotians, there's like hearts.
Exactly. There's legacies of racism that have affected educational progress for people in this province specifically.
Mm-hmm.
And so, what we're trying to really look at is increasing that representation within medical school and seeing exactly what are those barriers.
Right.
And so, a way to do that is to look at people holistically. So, should you not meet one criteria
Mm-hmm.
in the admissions process, that is not a grounds for you not going forward with your application. We actually look at you holistically and see if there are reasons or other parts of your application that can support you to be successful within medical school. Um, so we have a group of it's called the Black Learner Admissions Subcommittee, and it's
Mm-hmm.
made up of Black faculty, staff, community learners. And we look at all of the people who are Black who apply to the medical school now and provide a um, holistic lens that
Mhm.
is, we're attempting to be culturally confident in the way that we're looking at folks. And yes, it's in its first iteration. And so, right, it's a learning process. It might change over time, hopefully to be
Mhm.
better as we get more information. But yes, the goal is to increase the representation of all. So all Black people.
I love it. I love it. And
Mhm.
it's so important, especially for, yeah, African Nova Scotians, just because of the intergenerational trauma and everything that has
Mhm.
happened here. And Victory Speaks says, this is so good. There's love coming. I
Oh,
saw fire. I
yay.
saw
Oh,
some
good.
flames. Yeah, no, but it is important. And it does, like, we tend not to have the studies, but we know, like, in the United States,
Yes.
where there are Black providers, you see better outcomes
Yes.
for Black patients, but also, a number of other different groups, just like better outcomes, period. So I
Absolutely.
think it's something that benefits the whole healthcare system when we are represented and we're bringing our ideas and we're bringing our lived experience and we're working in healthcare and healthcaring differently, like not being ashamed of that
Absolutely.
difference. As soon as you feel safe and open enough to
Mhm.
be your authentic self, bring all of it, because
All
that's
of
what's
it.
going to bring the healing and the help to the people who need it most.
Mhm.
Most often those are the skills. And you're talking about working with people who use drugs, and
Yes.
it's that skill set that we are able to bring, and that empathy that you've described because of the
Mhm.
path that we walked. And I'm hoping that those of you listening, or you're going to share it with others, to
Right.
bring that energy, because we need it now in healthcare. Not because healthcare is so like great. Like, I know we're trying to recruit people to healthcare,
I
but
know.
it's not because it's so great. It's because it's needed. Do you know what I
It's
mean? Like,
so
we have to
needed.
change it. We have
Yeah.
to change it. Okay, we've
Yeah.
got Leah again, because I don't want to lie to people. I'm not here. I don't have healthcare
It's
issues for me to
true.
lie to you and say
It's
it's so
true.
wonderful. But it's like, if we don't do it, who will? And the pandemic
Yeah.
showed us there needs to be change. And y'all are the change. We're the change. We're not that old. We're the
Exactly.
change. I'm older than you, so whatever.
Yes. We're the
But
change.
all
We're
of
the
us are the change. All of
change.
us, all of us. So join.
Absolutely.
Oh, comments. I told you the comments come after. Look at this.
Right.
So now I have to read.
Right.
Look what happened. It's 8:36. This is when you people know to comment and ask
It
questions.
always happens.
Always. Okay. So Leah Geller
Drinking my
says,
bubbly.
yes, yes, go ahead. I have no questions. Just wanted to say, thank you so much, Leah, for sharing your awesome and needed initiatives and
Oh.
self-reflection. Also, we are named twins.
Oh,
Mine is just spelled differently. It's so
beautiful.
cute.
Thank you,
All
Leah.
right, Leah. Victory Speaks, and we need more Black medical research. Yes, yes.
Yes.
So
Yes.
my first person that I interviewed on here, Dr. Aisha Lofter, she's
Right.
a clinician scientist, right? So, somebody who is a physician, family doctor, and has a PhD and plays
Yes.
mass in Jamaica Carnival. So go back to that episode. We talk about playing mass, and
Love.
has a family and everything. But so we need medical researchers who are obviously fantastic when MD, PhD, but we need our PhDs
Oh,
to
yeah.
be involved in that research. You don't have to be a medical doctor to be involved in
Hmm.
change and healthcare, in a different way. And also for, as far as family doctors, I mean, we already had our meeting in the past, Leah, but where we can be
Yeah.
involved in research, we try to, take those opportunities, even though we don't have a PhD. So we need
Hmm.
that research. Mind you, there are challenges with getting the funding, with getting peer review. You know what I
Right.
mean? I'm not even trying to pretend, because there's lots of
No.
researchers. We're not always given the same opportunities. But the more of us that are in
Hmm.
the space, the louder our voices are, and we are seeing some change. Do you want to comment on that?
Absolutely.
I have to like scroll
Yeah.
through and look
So
for the
I was
other.
just
There's
thinking
more
too of
comments.
um,
Go ahead.
Imhotep Legacies Academy. That's
Mm.
another initiative through DAL, and it's to increase the amount of Black people within STEM. And so it's more broad than health, and there's research opportunities. I did one in one summer through Imitep, so something to look into too if you're around Halifax area. It's called Imhotep's Legacy Academy, and it's a
Okay.
great program too.
Girl, we need to put that in the newsletter. So we're going to talk
Yeah, yeah,
offline, because we want people to know about all of the opportunities, even if it's only for local
yeah.
folks.
Yep.
Local folks read our newsletter. We want everybody, like, let's just, You know what I mean?
Yeah,
Make everybody know
absolutely.
all the things.
We call it
So,
ILA.
right?
Yeah.
Keja says, I'm in Nova Scotia and looking to apply in this coming
Yay.
cycle. Yay! Do it, do it, do it.
Yay.
Thank you for breaking it down, and I look forward to hopefully meeting you. Oh, I love
Yeah,
it. I
oh,
love it.
me
Hopefully you
too. And we're
will.
gonna have info sessions, so keep an eye out on the plans Instagram. But
Perfect. And
yeah,
send to us. We're happy to like send out in our
perfect.
stories. So tell your
Yeah, yeah,
plans, comms people. We're like, we're about it. This is the
perfect.
movement.
That's
I'm,
great. Yes.
you know, I'm like wild, right? Like I'm
No, I
not even like
love
this
you.
is a small. No, this is a movement, and we're gonna change
Yes.
healthcare.
You're
Okay.
like, don't be shy. We're putting this
We're put
live.
right. Yes. Please,
Yeah.
please apply. Okay. What about Black international students from the Caribbean? Are there
Hmm.
opportunities for us? So that tends to be a really big challenge because it's at the federal and other levels, but
Yeah.
maybe you can speak to this. Do you have any?
It's a good question. I don't have any specifics right now, but if you reached out to me about your certain situation, I can do some digging. That some people have done that with me already.
And how do
There's
people
lots of
reach out to you
intricacies.
if people want to reach out
Oh
to you?
yeah, I would
Is it
do
through
just
this plans?
plans,
Okay.
do plans at dal.ca, the email, and then they just forward me all the ones that are specific. Um, so yeah, just shoot us an email and we'll try and help navigate because it's so complicated for no reason at times
Girl.
for people who are trained. Yeah, yeah,
Okay.
yeah.
Okay.
Sorry, it's not that helpful though
No, but I think it's
right now.
wonderful that you're saying, there's a way to contact you.
Yeah.
And then I saw some love in here. Like, so Victory Speaks 7 said to at Keja, I hope you are successful. I
Oh,
love that. The village is like
yes.
sending well wishes to
See the
Keja,
village. Yeah.
right? Well, that's what I say for health caring differently. I'm like, not everybody has a family member who's a doctor. So I'm on here like
Absolutely.
auntie and I'm bringing my friends and we're spilling the tea, right? Like,
Yes.
so where your aunties
Yes,
say
I'll
we
be your
don't do
auntie
that,
too.
right? So Cages, and then Cages said thank you. And then Victory
Oh,
Speaks said,
also
and it's
sweet.
so good that you amplify this as it lets our greater community know how important this is.
Oh,
Yes, it's
oh,
so
yes.
important. And thank you all for tuning in for the love. So Poche just said, okay,
Yeah.
thank you for the information you gave. And Laz Shao said, um, thank you so much for this insightful conversation. Okay.
Oh, great.
So
This
I
is
feel with that,
lifting me up today
right?
after a long day in the hospital. So thank you all for that. And thank you, Dr.
And I
Nnorom.
appreciate you. You know what? I appreciate all the docs and nurses and everybody who have come forward to do the, like you said, you're just after a long day,
Oh,
but it is so
yeah.
needed. And,
Yeah.
we love you. We love what you're doing. And you know what I
Oh,
mean? We appreciate you. We see you. We
oh,
appreciate you. It's not easy, but we appreciate it.
really
Um,
beautiful. Thank you.
Yeah. Okay. So we'll adjourn here, but I will follow up with you so we can put more of these Imhotep,
Yes,
and anything in plans. Let's, have our comms people crosstalk so we're able to cross promote and let people know.
absolutely.
And otherwise, I want to thank everybody for tuning in.
Thank
For the
you.
spring season, we've got one last episode. So that's with Dr. Nahid Dosani, who is an
Yeah.
activist, palliative care physician, and works with people experiencing homelessness. So it's going to be a cool end
Amazing.
of the spring season, and we'll be back in the fall. We ain't going nowhere. We'll be back in the fall, but we're just gonna,
So good.
chill for the summer, right? But that's it. So we'll see you next Tuesday, and otherwise, thank you, Dr. Jones.
Oh, thank you so much again. I really appreciate being asked to be here. It's been a privilege doing the work that I'm doing. So happy to share and continue to lift as we climb, right?
Yes, always inspiring. Oh, Victory Speaks says, great conversation, doctors. Love saying that. Rest up, Nicole. All right.
Oh,
Okay. Good night,
all right.
everyone.
Night.
Bye.
Thanks. Bye.